Welcome everybody. I'm Dr. Weily Jeng of Wellcome Clinic. Today, I will introduce you health management at my clinic. I will present you 4 parts. Part 1. Put prevention into practice from the first visit. Part 2. Measure, record, share health information at each visit. Part 3. Chronic disease management. In this part, I will show you how to management diabetes care plan, early CKD care plan, and quit smoking service. Part 4. Remind system. This is the front page of medical record. During the first visit, the patient will fill out the basic information. Then, nurse will measure waist circumference, body weight, body height, BMI, blood pressure, blood glucose, and nurse will ask the patient if they smoke. If they smoke, then we will provide quit smoking service at the same time. Nurse will check review of system. At the left side is symptom. If the patient have any symptom, they will circle around the symptom. At the right side is the chronic disease of each major organ system. If they have any chronic disease, the patient will circle the disease. The HIS will pop a window if our patient meet the criteria of adult health exam or FOBT, so we can provide preventive service into practice at the same time. During the checkup, if the nurse see high blood glucose, then they will arrange rapid HbA1c test. If the BP monitor or rapid EKG show abnormal, then nurse will arrange 12-lead EKG immediately. If the patient has intermittent claudication or cold feet, then we can arrange ABI test immediately. If the patient has symptoms of benign prostate hypertrophy, then we can check uroflow rate immediately. The nurse will input each patient's chart, payment, and check any condition like first visit, see doctor, refill of chronic disease, quit smoking service, adult health checkup, FOBT, send sample to laboratory, which laboratory is the report coming back, who deal with the report. If nothing behind, then the nurse will check finish it. The nurse use device from Inventec appliance to check patient's EKG, blood glucose, and BP. It's very convenient. During the same time, doctor can search the NHI card content and the NHI cloud health information to see if the patient has any major health problem or chronic disease. The Inventec appliance provide free app for patient, family, and health professional. In Easy Doctor website, they provide clinic to show every patient's data of blood pressure, blood glucose, cholesterol, EKG, body weight, etc. If the doctor click the main page, then we can see the patient's all the data about BP, glucose, cholesterol, EKG. So it's very convenient to communicate between patient and the clinic. Because we check every patient's glucose at each visit, so we can see a lot of abnormal findings. And if we found some patient is the high risk of diabetes, we'll arrange point of care test of HbA1c. Use fingertip blood to see the HbA1c report after 6 minutes. We use Skylar High Analyzer. This is our lab report. As you can see, 3 records per item. So it's convenient for doctor to explain the improvement, and the patient will understand very quickly. In our clinic, we use real-time healthcare information system. In this screen, you can see that each outpatient's chart number and the patient name. After the patient name, we add text. K for CKD, D for DM, S for quit smoking service. So it's very easy to identify our patient with certain health care plan. For follow-up, so I created some code like DM, DM0, DM123. You can see that if I input DM, it means prepare related study for this patient. If DM0, it means the study is completed. We can enroll the patient next visit. DM1, it means we enroll the patient now, and the HIS will automatically remind us 49 days later. DM2, the HIS will remind us 70 days later. Now you can see the CKD care plan. Likewise, CKD CKD 0, CKD 1, 2, 3. The only difference is CKD 3 means the patient's renal function is too bad, so we need to transfer the patient to pre-ESRD care plan. At each visit, when doctor input some code or some diagnosis, then the HIS will calculate how many days later we need to follow up. So you can see the follow-up list to see which patient has what to do and when. So we can export the file into an Excel file. Besides the follow-up list, we can use the HIS search code. So order code, we can even use group code like CKD-DM-QD. It means CKD and the DM related code together. So we can create the patient list very easy and quickly. Okay, the summary. For prevention into practice, it's easy from the first visit because we search chronic disease by front page, HIS, NHI card, NHI cloud, and the measurement data in the lab. The part 2 show you how we record and share information at each visit by APP and the online service. Part 3, chronic disease management. We show you how to tag the chronic disease patient and enroll follow-up annual visit transfer. First, finally, the remind system, you can see how we use a follow-up list and how to search order code, so we can timely follow up the patient. If the patient didn't show up, so the worker will input some memo in HIS. So when patient show up, we will know what to do. Thank you. If any comment, please contact me. Thank you very much.